Okay.
Ready?
Great. Yeah.
Hi, I'm Shannon Pohl. I'm from the Alliance of Chicago Community Health Services, and our project here is using health IT tools to improve immunization management in community health centers. The Alliance of Chicago is a community health center network, primarily with over 32 organizations of federally funded health centers, primarily serving marginalized low-income communities, so those that are uninsured, underinsured, and Medicaid patient populations. So as a result, our mission is to improve the quality of care for these patients using health IT in order to lower the cost of healthcare and increase their quality of outcomes. So our project today that we're going to be demonstrating is how to use these tools to improve immunization management, especially among these populations. Their immunization rates are at lower as what the CDC recommends for these patient populations, and we want to increase up their rates in order so that they're protected from these diseases. We utilize the EHR to document the primary care that they receive at these health centers, and then based on that, Nathan Taylor, my colleague at the Alliance, will talk about the data extraction and how this data is used.
Okay.
Yeah, so the initial reports that we built were just overall views of the entire health center and what their immunization rates were. And as Shannon mentioned, we based the data off some of the initial forms that were built to get some baseline numbers. You can see that they're very low to start out with, going back about 2 years ago. From there, once we were to identify the rates were low, we were able to pull individual patient detail lists and then find out which immunizations were missing in the immunization schedule, and then recall those patients and have them come in and get the immunizations that they were missing. In addition to those detail level reports, then we also generated some information at the provider level so we could identify individual providers that were struggling to get patients into the list.